Infarction. Infarction can be defined as it is a process where tissue necrosis is formed, mostly because when there's any insufficiency in the circulatory system, this results in a tissue necrosis, and this process is known as infarction. And that particular area, whichever is being exposed to this infarction process of circulatory insufficiency, that particular area is known as an infarct. So there's a picture where we can see that there is, at the right side of the picture, there's a blood clots formed within the artery, because of which there's insufficiency in the circulation. The blood cannot be flowed properly, and because of which it results in the necrosis of the tissue, whichever is being suffered with such circulatory insufficiency, and this results in formation of an infarct. So mostly the causes for this infarction to occur, it is mainly because of an embolus. That is, this embolus could be any kind of blockage, which could be either because of a fat globule, or otherwise because of any gas bubble, or otherwise because of any blood clots. This might result in embolus formation, and this will block the circulatory system. The next coming is thrombus. Thrombus is nothing but it is distinct from embolus. Embolus is a clot or otherwise any obstruction which is being carried into the circulation, which is not confined to its origin, whereas thrombus is a clot or otherwise any obstruction whichever has been formed and is confined to its site of origin. So these could be the probable causes, that is the embolus and the thrombus of an infarction. Other than that, we can also see an atherosclerotic plaque. That is, we see that there's alteration in the wall of the arterial system, and this thickening of the arterial system is known as atherosclerosis, and this thickening of the detachment of this thickening from the arterial wall is known as atherosclerotic plaque. So this could also be one of the reasons for infarction to occur. Other than that, we also see vasculitides as well as vasoconstriction. When there's any constriction in the vasculature or otherwise shrinkage in the vasculature, this might also cause the hampering in the circulation of the blood flow and result in infarction. So there's the right side, the picture shows that there's any blockage in the artery, and this results in damage to the myocardium of the heart muscle, and this will result in the infarction. So these are certain causes of infarction. Coming to the types of infarction, usually based on the color, they might be classified into pale or anemic type, or red or hemorrhagic type. And based on according to their age, they can be classified into recent or fresh, old or healed ones. And based on the presence or absence of infection, they can be classified into bland or otherwise septic type. So these are certain infarcts which have been classified based on their color and based on their age, as well as based on their presence or absence of infection. Coming to the pathogenesis, how infarction occurs, usually as already said, it is mainly because of the obstruction in the blood supply. When there's any obstruction in the blood supply, since blood even carries oxygen to the other body organs, so there's because of this obstruction in the blood supply, the oxygen is also not being supplied by this blood which has been obstructed to the particular organs which are being suffered with it, and this results in local anexemia, and this local anexemia results in local hyperemia. That is because of which there will be alterations in the temperature also, and this might result in alteration in the escape of the tissue fluid, and this will cause edema, as well as associated with it hemorrhage can also occur. And this will result in the formation of cloudy swelling and degeneration of the affected organ. Once there's degeneration, there will be necrosis formed, and this necrosis it is being replaced by the necrotic tissue will be replaced by a process known as proteolysis, where there will be breakdown of the proteins, and once there's breakdown of the proteins and this results in proteolysis of the necrotic tissue, there will be lysis of the RBCs which are present in that infarct area, and this will cause acute inflammatory reaction, as well as hyperemia will result as a consequence of RBC lysis. Once hyperemia, this is being followed by deposition of the blood pigments, as in it can be seen that there are deposition of the blood pigments within this infarct area, that is within the localized area which is being suffered with infarction, and this is being followed by the formation of granulation tissue. Since it's an healing scar because of the degeneration of the necrolytic area, this will result in the formation of granulation tissue, and this results in formation of ultimately a fibrous scar will be formed. This is what happens in the infarction. Coming to the morphological features of infarcts, usually grossly when we see an infarct, that is a gross specimen, it is usually wedge shape, and usually the apex, it points towards the artery whichever has been occluded, and whereas the wide base, it takes its base on the surface of the organ whichever is being affected with this process of infarction. And microscopically, when we observe under a microscope, we see that a characteristic feature of any infarction, it is a coagulative necrosis, or otherwise known as ischemic necrosis. Ischemic necrosis is nothing but an area whichever is being supplied with inadequate blood supply is known as ischemic area, and that kind of area whichever is being suffered with necrosis because of an infarction is known as ischemic necrosis. Then this usually we see that under a microscope that this coagulative necrosis is being usually replaced by a fibrous scar tissue. That is, we find that of a formation of a granulation tissue along with collagen fibers, and hyalinization of this fibrous tissue can also be seen, which implies that it is a scar tissue. And this, if it is not being removed in an appropriate time, this might further result in calcification. That is, deposition of abnormal calcium salts as well as minerals on this fibrous scar tissue might result in calcification. So based on particular locations or particular organs whichever this infarction is being characterized, they can be characterized into myocardial infarction. That is, whenever the heart is being suffered with any decreased cardiac output and there's a decreased in the blood supply, heart functioning system, this might result in ventricular fibrillation, and this ventricular fibrillation might result in further infarction. When we see the gross specimen, it appears in wedge shape and it appears red and hemorrhagic, or otherwise it depends on the age. That is, if it is a fresh one, it appears red or hemorrhagic. Suppose it's an older one, it appears pale or anemic type. And microscopically we find there's atrophy of the myocardial fibers and alteration in the myocardial muscles cells also we can see. So this is what we see in myocardial infarction. Coming into cerebral infarction, usually this occurs in cases mostly when there's insufficient blood being supplied to the brain, that is in turn because of the reduced cardiac output, because of which cerebral infarction results, usually based on the timing. Suppose if the cerebral infarction is for within 15 seconds, then the patient might result in consciousness. Suppose if this cerebral infarction exceeds for more than 4 minutes, then the patient might suffer with encephalopathy. Suppose the patient is, if it has been crossed more than 4 minutes, then it might result in inevitable death of the patient. Since brain is being lacking with this blood supply, this might see the conditions, probable conditions which might occur. And coming to the cerebral infarction, we see that the neurons are being damaged in this microscopically, as well as we also see gliosis, that is there's complete replacement of the microglial cells with the necrosed tissue, which is nothing but an infarct area. Coming to the infarct of the lung, usually we see when there's any blockage to the pulmonary arteries because of any occluding substances such as embolus or thrombi, this might result in an infarct of the lung. Usually we see that the infarct of the lung, it is also wedge shape and the apex usually points towards the lobes, and most commonly involved lobes, it is the lower lobes what we see is. And microscopically we can see that there's arteritis, that is inflammation of the pulmonary artery system can also be seen. Coming to the kidney, usually this occurs when there's any thromboemboli which are being originated from the heart, and this might occur when there's any renal arterial system or the renal veins. Whenever they are being blocked by this thromboemboli, this might result in infarction of the kidney. Similarly, we see that it is wedge shape and it might be pale and anemic, and the cross specimen might appear waxy and translucent. And when we see the microscopic appearance, we see that the glomerulus as well as the nephrotic kidney nephrotics area, they are usually atrophy can be seen of this particular area. Coming to an infarct of a spleen, usually we see that it is very rare to see an infarct of a spleen, but if we see it is similar in appearance as that of the kidney. Coming to the infarct of the liver, usually it is very uncommon to occur infarction in the liver, since the liver is being supplied by the hepatic artery as well as the portal vein, and this forms a dual blood supply. So even if there's any blockage in one of the artery, that is the hepatic artery or otherwise in the portal vein, this might not actually cause the this kind of infarction, but rather it might result in non-ischemic infarction, which is known as infarct of Zahn, and this infarct of Zahn can be seen appear in the microscopically, can be seen under a microscope as an area of incomplete blood supply being supplied to an artery. So these are the certain morphological features of infarcts whatever we have seen. So there's a picture, first picture showing the myocardial infarction, where a reddish color can be seen within the artery, which might cause a blockage in the arterial system and finally cause the inadequate blood supply, and which might result in an area of infarct. And there's a cerebral infarction where we can see which is being outlined with a red line, and the atrophy can be seen of the particular cells within the brain. And the left picture is a histopathological picture which can be stained with the H&E stain section showing a pulmonary infarct, and the right side it is a renal cortical infarction can be seen, where the edge of the infarct it is usually shows that it's a normal kidney, where we see it in the upper left side, whereas we see necrotic tubules and the glomeruli in the infarct, usually which with preserved cellular structure and outlines with an intact nucleus can be seen at the picture, and this is this explains that there's renal cortical infarction. So these are the certain pictures which show about infarct. And coming to the gross specimen of a splenic infarct, we see that it is dark in color, which could probably be a fresh splenic infarct, and it is usually firm to soft in consistency, and cut section might show numerous sinusoidal appearances can also be seen in a splenic infarct. Coming to ischemia. So ischemia, it is usually defined as a deficient in the blood supply to a particular part of a tissue, similar to that of the as we have seen in infarction. We also see which is because of an inadequate circulation of the blood supply. Ischemia is also such condition where we see that the blood supply is very deficient to a particular area. Usually we see the etiology, it could be probably the causes in the heart, such as when there's any blockage in the heart, or otherwise when there's any decrease in the blood pressure system, and because of which there will be decreased amount of blood supply which is being pumped out, and this might result in ischemia. And coming to the causes in the artery, usually when we see when there's any arterial lumen is being occluded with any thrombus or embolus, this might also result in cause in the artery. Other than that, we also see when there's any pressure on the artery from the outside, usually when there's any tourniquet application or otherwise any bandage application, we see that this artery is being compressed, and because of which there's even reduced blood supply to that particular organ. So any causes in the artery can also result in ischemia. Suppose these causes in the artery could also be within the artery, within the lumen of the artery, or within the wall of the artery, or otherwise any pressure on the artery completely might result in causes in the arteries, and which could be an etiological agent for ischemia to occur. So within the lumen, when we see within the lumen of the artery, when there's any thrombus or embolus formation, it might result in ischemia, or otherwise within the microvasculature, that is within the wall of the artery, it might result in conditions such as arteriosclerosis or arteritis can also result in ischemia. When there's any pressure on the entire artery, it could be probably because of any tourniquet application, or otherwise because of any bandage in certain condition, it might also result in ischemia. Coming to the causes in the veins, similarly within the lumen of the veins, we see in case of cavernous sinus thrombosis or any thrombosis, this could also be one of the reasons for ischemia to occur. Otherwise, in the microvasculature wall of the veins can also be seen, such as in deep vein thrombosis could be one of the possible reason for in the wall of the veins. Other than that, pressure on the veins because of any bed sores can also be one of the reason for ischemia to occur. Coming to the causes in the microcirculation, suppose there's any obstruction to this microcirculation within the lumen, or otherwise within the microvasculature wall, or otherwise because of any pressure from outside, might also result in ischemia. So these are certain etiological factors for ischemia to occur. Coming to the factors which are directly dependent on the ischemia, factors which affect the ischemia condition is based mainly on the anatomic pattern. If it is a single arterial supply without any anastomosis, then it might result in a varied range of loss for the blood supply and result in ischemia. Suppose it has it is a single arterial system with rich anastomosis. We see that this blockage in one of the arterial system might be compensated with anastomosis with the other minute arterial branches, and this loss of the blood can be compensated with that extra arterial branches, which might compensate the losses with the blood from the main arterial branch. Coming to the parallel arterial supply, that is there's a dual supply to one tissue by 2-3 branches, such as we have seen in liver. We see that there's even the portal vein as well as the hepatic artery, which is being supplied to the liver. Blood is being supplied through the vein as well as through the artery in liver. So in such conditions, this ischemia can be rather being escaped because of this both the dual blood supply. Coming to the double blood supply, similarly, if one artery or one vein is being damaged, it can be compensated with the other artery or vein, whichever is being supplying that particular organ. So this can also help in this could also aid as one of the factor for ischemia not to develop. Coming to the general factors as well as the cardiovascular status, usually we see in conditions such as anemia as well as in shock or otherwise in blood loss condition. These are the factors which actually contribute for the ischemia to occur in such conditions. Coming to the type of tissue affected, usually certain organs and certain tissues within the body, they are more vulnerable to this ischemia. So among them, such vulnerable tissues includes the brain, heart as well as the kidney. So these are the tissues, they make it more prone for the ischemia to develop rapidly rather than compared to the other tissues in the body. Coming to based on the rapidity of the development of the ischemia, it might also cause the sudden obstruction, might also result in rapid loss of the blood, and finally result in more of ischemic necrosis, and this could also aid as one of the factor for ischemia to develop. Coming to the degree of vascular occlusion, suppose if it is a normal thrombus of a minute thrombus, then it might not be so much damaging to that particular organ, but rather a larger thrombus might cause complete vascular obstruction and result in ischemia, and followed by it consequently with ischemic necrosis. So these are certain factors which aid in for an ischemia to develop. Coming to the effects of that particular ischemic area, they have a wide range. They may range from no effect, that is there's no complete effect on the tissues, or otherwise it might range up to sudden inevitable death of the patient can also result because of the complete loss of the blood supply. And other than that, we also see there are even certain functional disturbances that is based on the amount of blood being supplied. It might also result in compromised functioning system of that particular organ. Other than that, we also see certain cellular changes in an organ which is being exposed to this ischemic condition. We see that there's cloudy swelling as well as fatty changes, degenerative changes can also be seen in organ being affected with ischemia. So these are certain factors as well as effects seen in ischemia. Coming to the ischemic casket, usually we see when there's any metabolic waste products which are usually being built up, this might result in an inability to maintain the cell membrane, because of which there will be mitochondrial damage, and this is being followed by autolyzing proteolytic enzymes which usually leak into the cells as well as into the surrounding cells, and there is a damage of that particular organ, and this is what we see in ischemic casket. Coming to reprofusion, that is when an organ is being actually trying to compensate with that ischemia with the help of separate alternative blood supply, then that condition is known as reperfusion, and it is usually affected with the help of free radicals as well as with reactive oxygen species, and also in presence of calcium overloading as well as exaggerated inflammation can also be the reasons, factors which usually lead to a condition known as reperfusion. Coming to the signs and symptoms of ischemia, usually we see it is being denoted with 6 P's. That is all the system signs and symptoms. They start with the letter P, which could be a probable one of the synonyms for ischemia. And it is we see that the patient might suffer with pain as well as change in the color. Patient might show the affected organ shows paler because of the lack of sufficient blood supply. Other than that, we also see there's loss of pulsations can also be seen, which is a condition known as pulseless, and paresthesia, that is temporary patient might undergo loss of sensation, partial loss of sensation can be seen, and paralysis of the patient might also be seen in severe conditions. And other than that, there's altered thermal conditions, temperature of the body temperature known as poikilothermia can also be seen. So these are signs and symptoms of infarction. Coming to shock, shock by definition it is usually a life-threatening clinical syndrome because of a cardiovascular collapse which is being characterized by an acute reduction of the effective circulating blood volume, and this condition is known as hypertension. And other than that, we also see that there is inadequate perfusion of the cells and tissues, that is since blood is being compromised, oxygen is also being compromised, and because of which the cells and tissues undergo condition known as hyperperfusion. So in shock we see there's hypotension as well as hypoperfusion can also be seen. So this shock can be categorized into three types. One is the true type, secondary type, also known as circulatory type. It is usually a condition where we see when there is any circulatory imbalance between the oxygen supply as well as the oxygen required by that particular organ at a cellular level. This can lead to true or otherwise known as secondary shock or otherwise known as circulatory shock. Then coming to the next type of shock, also known as initial or otherwise primary shock. It usually it is because when there is any benign vasovagal attack, which is usually because of a sudden reaction of a reduction in the venous return to the heart, it might result in neurogene vasodilation. That is, there will be vasodilation of the neurogenic conditions, and this might consequently result in peripheral pooling of the blood and might lead to a condition known as initial or otherwise known as primary shock. Coming to the classification and etiology of shock, usually it can be classified into hypovolemic shock, under which it is seen in conditions known as acute hemorrhagic conditions and dehydration. When there is loss of blood volume or otherwise water from the body, it might also result in hypovolemic shock. And the other shocks, they can also result, the type of shock is known as cardiogenic shock. It is usually seen in conditions when there is deficient emptying, otherwise deficient filling of blood, or otherwise when there is obstruction to the normal circulatory blood flow might also result in cardiogenic shock. Next, coming to the septic shock, which is mainly because of the microorganisms. It could be because of the gram-negative organisms or otherwise gram-positive organisms. When it is because of the gram-negative septicemia, it is known as endotoxic shock. Where it is because of the gram-positive, it is known as exotoxic shock. Coming to the other types of shock, they are the traumatic shock, neurogenic shock, as well as hypoadrenal shock. So these are certain shocks and based on the particular etiology. Coming to the pathogenesis, usually we see shock seen under 4 stages. First is the initial stage, then comes the compensatory stage, which actually tries body is being adapted to certain responses where it might try to compensate for the losses within the body, and this stage is known as compensatory stage. Suppose this compensatory stage is not able to completely cope up with that of the losses, then it might result in progression of the initial stage of shock, and this is known as progressive stage. And the refractory stage, that is, it is after the treatment the patient might try to completely retain to the normal position. This is known as refractory stage. So these are the four stages, and we see the pathogenesis of shock is as followed. First we see that there is inadequate perfusion to the cells and the tissues. Because of this inadequate perfusion, that is inadequate oxygen supply, it might result in cell hypoxia. And this, since oxygen is necessary for the production of energy, there will be reduction in the energy, and this is known as energy deficit. And this energy deficit, since energy is not being completely produced, it is being this will be followed by accumulation of the lactic acid. And since there's accumulation of this lactic acid, and there's even change in the pH, since this is an acidic condition, there will be decrease in the pH, which will be below 7, and this condition might lead to an compensatory mechanism known as anabolic mechanism. Suppose this mechanism is not able to cope up with that of the losses with the oxygen and energy, and then it might lead to a condition known as metabolic acidosis. This metabolic acidosis is also one of the compensatory mechanism where it tries to cope up with that losses of the oxygen as well as with the energy by causing vasoconstriction, and this vasoconstriction in turn will cause the failure of the precapillary sphincters, that is the sphincters which actually are seen at the edges of the capillaries, which actually help in passing of the blood during conditions of shock, and then thereby there will be peripheral pooling of the blood. So this is what we see when the metabolic acidosis is into progress. So then metabolic acidosis will be followed by cell membrane dysfunction, and this cell membrane dysfunction is being associated with the failure of the sodium pump. Since cell membrane, there will be damage and there will not be sufficient permeability for the pumping of the sodium ions outside, and whereas influx of the calcium ions as well as absorption of the water, this might result in the failure of the sodium pump. And this is being followed by intracellular lysosomal release, where the lysosomes, they release certain digestive enzymes, because of which there will be reverse in the sodium pump, where there will be, instead of the influx of the potassium, there will be efflux of the potassium, whereas instead of the efflux of the sodium and water, there will be influx of the sodium water, because of this alteration in the enzymes being released by these lysosomes. And because of this, there will be more of toxic substances which enter the circulation because of the altered function of the lysosomal enzymes, which are actually meant to debride the toxic substances, but rather they help in more of hampering and accumulation of this toxic substances, because of which they enter the circulation. And once they enter the circulation, they obviously cause the damage of the capillary endothelium, and this in turn will cause the destruction, dysfunction, as well as complete death of the cell, whichever is particular organ, whichever is being exposed to this condition of shock. So there is a pathogenesis of shock, whatever we have seen till now. Coming to the types of shock based on the organs particularly involved, we see cardiogenic shock as first, where it is mostly because of the severe left ventricular dysfunction. Usually when we see there's any dysfunction in the heart, this might directly have an effect on the cardiac output, because of which there's even decreased cardiac output, because of which there'll be a decrease in the circulation of the blood and decreased pumping of the blood even to other organs, and it might result in a condition known as cardiogenic shock. Other than that, we also see another type of shock known as hypovolemic shock, where we see that it is mostly because of the inadequate circulation of the blood volume. This is in turn because of the decrease in the cardiac output, because of which we see certain conditions associated with it, that the patient might manifest with oliguria to anuria. Other than that, we also see patient might suffer with hypotension. If this condition progresses, patient might lead to death. Coming to the next type of shock known as septic shock, it is usually because of the microorganisms known as gram-negative bacteria. Usually when the microorganism which acts as a foreign antigen in our body, when it enters, there'll be immune host system comes into action, and it causes the lysis of this bacteria. And because of the lysis of the bacteria, that is breakdown of the bacteria, this bacteria releases certain toxins. This certain toxins, they have an effect on certain cells, and that is in lipoprotein binding cells. This toxin is nothing but lipopolypeptide. This lipopolypeptide comes and binds to the protein known as lipopolypeptide binding protein, which is usually present in the circulating blood. Once this forms a complex with this lipoprotein, then these have an affinity to bind to the cells of the immune host system cells. They are known as macrophage monocytes. So these come and bind to these cells, and these cells have receptors known as surface receptors known as CD14. So once this gets and comes and binds this lipoprotein binding protein complex, once it comes and binds to the CD14, which is present on the host immune cells, then these cells, they get into activation, and they elaborate the granules which are present within the macrophages and the monocytes, and they release certain structures known as cytokines. These cytokines, they in turn have an effect, and these cytokines, they constitute the tumor necrosis factor alpha as well as interleukin 6. This tumor necrosis factor alpha and interleukin 6, they in turn have an elaborate the host immune defense system, and thereby cause the alter the endothelial cell adhesiveness, as they alter the endothelial cell adhesiveness by a property of recruiting the neutrophils. They have a property that they recruit increased number of neutrophils to the damaged endothelial cell area, where they once they get accumulated, these neutrophils, they cause a direct damage to this endothelial cell membrane. And other than that, we also see that They also, these neutrophils, they produce nitric oxide synthetase, which acts as a vasodilator as well as increases the capillary permeability, which might in turn also have a damage on the endothelium. So these are certain things which are being activated because of the gram-negative bacteria lysis by the host immune system. Other than that, we also see that there are certain inflammatory responses which are usually being activated, and these inflammatory responses in turn, they cause the activation of the complement pathway, where the components known as C5a as well as C3a, both of them get activated, and these in turn have an effect on the endothelial membrane, which might damage the endothelial cell membrane. Other than that, we also see there's activation of the mast cells. Since mast cells are the structures, mononuclear cells, which constitutes of granules within them, and these granules, they contain histamine. This histamine is also a vasodilator and also has a property of altering the capillary permeability, which might in turn cause the damage in the endothelial membrane and cause the accumulation of the bacteria, and which might result in septic shock. Other than that, we also see that there's activation of the coagulation system. This coagulation system, which might in turn cause the formation of thrombi as well as the formation of fibrin because of the defibrillation syndrome, and might result in which might also contribute for the septic shock to occur. Other than that, we also see there's activation of the kinin system, where bradykinin results degrades and forms kinin, which is also a vasodilator. So all of them in turn cause the activation of the condition known as septic shock. So these are certain types of shock, whatever we have discussed. That is a cardiogenic shock, hypovolemic shock, and septic shock. Coming to the shock based on the organs which are being affected, we see hypoxic encephalopathy. It is a condition when the shock is being involving the cerebral system, that is the brain. It is seen in conditions such as hypovolemia, when there is decrease in the blood circulating blood volume, or also in conditions such as hypotension, where we see because of this there is insufficient supply to the brain, and the patient might result in a condition known as altered condition of consciousness, because of which the patient might microscopically, there'll be a kind of the microscopic features. We can see that there's alteration of the particular structures known as Purkinje fibers as well as the neuron cells. Other than that, we also see that the glial cells are being replaced by necrotic tissue. So this is what we see when the shock involving the brain. Coming to the shock in heart, usually we see in conditions when there's decreased cardiac output, otherwise when there's left ventricular dystrophy or failure, which might result in ventricular fibrillation and ultimately result in shock in heart. And usually microscopically we see there's hemorrhage as well as necrosis in the heart. Other than that, we also see zonal lesions, that is we see contraction bands in the myocyte region, that is in the muscle system of the cardiac system, and these are certain microscopic features whatever you find in heart and shock. Coming to the shock in lung, usually this is rare because of the dual blood supply, that is a sufficient blood supply to the lung. It is very rare, but other than that, even if we see in conditions where there's any blockage to the pulmonary arterial system, or otherwise when there's decreased cardiac output, which in turn carries reduced blood supply to the lung and might result in a condition known as shock in lung. Usually we see that there's fibrosis of the alveolar septum, and other than that we also see patient suffering with edema within the pulmonary system can also be seen in case of shock in lung. Coming to shock in kidney, usually we see this also which is internal complication with heart and shock, and in conditions we see that the glomeruli as well as the tubules, they might be mostly affected in case of kidney, and this condition because this can also be seen in cases of hypovolemic condition, that is when there is decrease in the circulating blood volume as well as decreased in the water content within our body, can also result in shock. And even we see there is numerous crushing of the veins and the arteries which are present within the kidney can also be seen. Coming to adrenals and shock, usually we see in conditions such as stress, where there are mostly adrenocorticoids can be, adrenal hormones can also be seen released. Other than that, we also see glucocorticoids can also be released in case of shock associated with that of the adrenal medulla. Coming to the liver in shock, usually we see features of nutmeg liver. Usually we can see where the hepatocytes are usually being altered. In case of shock in liver, microscopical appearance of the hepatocytes can be seen. That is, there's atrophy of these hepatocytes. Other than that, we also see that there's pycnotic nuclei can also be one of the finding, microscopic finding in case of hepatocytes, and the sinusoids, they also being obstructed within the hepatocyte channels. Coming to the other organs which are being affected by shock, there could be liver as well as spleen, lymph nodes can also be seen. Certain structures which are being affected, other organs other than the major organs in the body, these minor organs such as lymph nodes, spleen can also be seen affected in case of shock. So there is a picture showing the cerebral hypoxia can be seen at the right side. And coming to the shock in lung, usually the patient might manifest with acute respiratory distress syndrome, can also be seen as a manifestation of shock in lung. And coming to the shock in liver, we see that there's a white sinusoid within the hepatocyte cord-like formations, which is being stained with an hematoxylin and eosin stain. So coming to the typical signs, what we see in shock, usually patient might firstly show a condition known as hypotension, known as which is nothing but decreased blood pressure. Other than that, we also see that there's rapid heart rate because of the compensatory circulating blood flow. The heart might show a compensation for this decreased in the circulation and result in increased heart rate. Other than that, we also see signs of poor end perfusion, organ perfusion. Since there's decreased in the blood being carried, there's also decreased oxygen being carried, which might result in hypoperfusion of a particular organ. Coming to the complications, usually we see a shock which might progress into acute respiratory distress syndrome, mostly when it's an organ involving lung. Other than that, we also see the other complication what we see because of shock, it is a disseminated intravascular coagulation. And other than that, when we see that the kidney is being affected in shock, we see there's acute renal failure also. And as a consequences of shock in lung, it might also involve the other organs in the body, and this condition can be known as multiple organ dysfunction syndrome. Coming to the progression of this shock, suppose if it's not being recognized and corrected in an earlier stage, this might progress and the patient might ultimately lead into stupor, coma, and even death in final stages. So this is what is about shock.